Hello. For this week's journal assignment, we took an assessment to find out what our risk level was for type 2 diabetes, also known as diabetes mellitus. The assessment we took consisted of 10 yes or no questions. The more yes answers we had showed the higher our risk is for becoming diabetic. Thankfully, I only answered yes to one question, which was, do you tire quickly or always seem to be fatigued? It's reassuring to know that my risk for contracting type 2 diabetes is low. Diabetes can impact many of the dimensions of health and wellness. First, it impacts physical wellness by raising the risk of getting other diseases. In fact, diabetes mellitus is one of the contributing factors in heart disease, stroke, hypertension, kidney disease, and many other chronic illnesses. It can also impact our emotional health. Once diagnosed with diabetes, your healthcare provider may wind up asking you to completely revamp your lifestyle. You'll want to exercise daily, make healthy choices when eating, and forego eating a lot of delicious, sugary snacks and simple carbohydrates in order to regulate your blood sugar. The stress of all this change could really hamper your emotional wellness. They may place you on medications that can have side effects, which could make an impact on your productivity at work. This would wind up affecting your occupational wellness. The chronic complications of diabetes, such as painful nerve and muscle symptoms, can also affect all of these dimensions of health and wellness. More sick days may be taken from work, and you may not want to socialize as often because you feel fatigued constantly. But the good news is that, for the most part, type 2 diabetes is preventable. Heredity does play a role in developing type 2 diabetes, but by living a healthy lifestyle, you can reduce your chances of developing the disease. Obesity is one of the most important factors in developing type 2 diabetes, so maintaining a normal, healthy weight is important. The American Diabetes Association also recommends exercising at least 30 minutes a day for a minimum of 5 days per week, incorporating aerobic exercise, strength training, and flexibility exercises to ensure a well-rounded fitness routine. Along with routine exercise, a diet that is low in fat and high in fiber will help to reduce the risk of type 2 diabetes. And of course, not smoking will significantly reduce the risk as well. Not only will living a healthy lifestyle positively impact your life, it can even save it by lowering your risks for developing diseases with deadly consequences.